Good evening and thanks for joining us. Lots to get to on this Friday night as we enter the first Thanksgiving long weekend with COVID-19. The message to everyone is stay home and keep your circle small because the forecast is for the virus to accelerate.
We're at a tipping point in this pandemic. Not only is the second wave underway, yesterday we hit the highest daily recorded cases, well above what we saw this spring.
This is the shape of Canada's curve. Cases slowed over the summer but are now accelerating, and each new case is spreading the infection to more than one person. People between 20 and 39 still make up the bulk of new cases, but they are now rising in older, more vulnerable people too, and it's forecast cases will keep climbing unless changes are made. The bottom line? We need to reduce our contacts. In Ontario, tough new restrictions are now mandatory as of midnight tonight in 3 hotspot regions: Toronto, Peel, and Ottawa. That means no indoor dining at restaurants and bars. Gyms, casinos, and movie theaters will be closed. As of Tuesday, all wedding receptions will be cancelled. All of that remains in effect for 28 days.
All trends are going in the wrong direction. Left unchecked, we risk worst-case scenarios, first seen in Italy and New York City.
More federal support is on the way for small businesses caught in the pandemic restrictions. We'll have more on that in just a moment. But first, Couteur, and a closer look at where the virus is spreading and what's being done to slow it down.
It's come to this again. Restaurant owners are praying for pleasant patio weather because they're being forced to close indoor dining rooms for the second time in this pandemic.
It's a tough decision to make, but at the end of the day, it's public safety first. You know, it really sucks. It really does.
After weeks of resisting this decision, Ontario Premier Doug Ford was briefed with sobering statistics.
Didn't sleep a wink last night.
What Ford most certainly saw was where COVID-19 is being spread. The latest modeling numbers from the Public Health Agency of Canada show spikes in schools and childcare centres as they were reopened, but they were smaller clusters. A bigger concern is the steady rise in long-term care facilities and the large number of outbreaks related to large indoor gatherings.
If I didn't make this decision now, I'd be negligent. It was the single toughest decision I've made since I've taken office, bar none.
The good news is that the hospitalization rate across the country remains low, but that's because of who is contracting the disease. There's been a bump recently in the elderly, and the overwhelming majority is in 20 to 39-year-olds, according to the numbers from the Public Health Agency of Canada. Now, in the spring, a blanket ban on going out helped crush the curve. Facing an even worse second wave, the Prime Minister believes targeted shutdowns is the way to go.
We know a lot more about where transmissions are happening, what businesses and what activities create particular vulnerabilities, and that's why in the second wave we're able to be more targeted in our approach.
That's being coupled with a plea for people to stay home and stay away from each other, because health officials say social circles were much smaller in the spring.
Now when the contact tracers go out for confirmed cases, it's in the dozens or even 60 or 70 people, and why is that?
Doctors say those decisions by Canadians weeks ago have led to where we are today, but they have hope that people will heed the warnings now to prevent even tighter restrictions in the future. Donna?
All right, Couteur, thank you. Here is the picture across the country today. There were 119 new cases reported in BC, 277 in Alberta. In Saskatchewan today, 22 new cases reported. In Manitoba, 84. Ontario hit a new record, 939 new cases today, while in Quebec there were more than 1,100. 2 new cases reported in Newfoundland and Labrador and 13 in New Brunswick. 2 regions of New Brunswick are now moving back into that province's orange phase. The changes take effect in the Moncton and Campbellton health regions at midnight. Personal services like hair salons must close, plus gyms, casinos, and theaters. People need to stay within 2 household bubbles. The rest of New Brunswick remains in the yellow phase. Alberta is hoping new voluntary public health restrictions will be enough to reduce the spread of COVID-19 in Edmonton. There are now more than 1,300 active cases in the region. Here's what we know about how people are getting infected. About 36% of positive cases were exposed to the virus by a close contact.
Where transmission is known, household or community contacts appear to be a key driver in spreading the virus throughout the city. Social gatherings and family gatherings continue to be a factor in virus-spreading events.
Alberta's Chief Medical Officer of Health says 26% of Edmonton's cases are linked to an outbreak. Some have occurred in workplaces where the virus spread between employees. People in Edmonton are now being asked to wear masks in workplaces when they can't safely distance and to limit indoor family gatherings to a maximum of 15 people.